when it comes to aging, our skin certainly plays a starring role. So how well do you know what you should do to maintain healthy, youthful skin? Well, today we're talking with board certified plastic surgeon, Dr. Claire Dillingham, with Cone Health plastic surgery specialists about the smart non-surgical ways to prevent signs of aging and boost your health. We all want to know the non-surgical kinds of ways to do that, so we're appreciating that you're joining us. So let's just start with the basics. An important first step, our daily skincare routine. What should we be including in that daily routine?
So thank you for having me. Great question. So this is really a great time of year to really start thinking about your skin as the weather and the elements are going to be a little more active on our skin with the sun. So daily routine, especially this time of year, is going to be washing in the morning and the evening. Don't forget that evening wash, no matter how tired you are, and sunblock. Those are the two most important things you can do to actually clean your skin and get your skin looking and feeling healthier.
Okay, washing in the morning, washing at night, don't be sleeping in that makeup, and of course, sunblock during the day. All right, so beyond the skincare routine, what role do treatments like, I don't know, facials, lasers, red light therapy, you're hearing all about that right now, chemical peels, how do they factor in?
Those are really important things you can do for your skin, and you can do them at any age and really any time of the year. The laser is really good for pigment, for redness. So actually, I can show you an example here. So this is a patient that had rosacea. So that's your before and after. And you can see the benefit of the laser just after a few treatments. And then if you have sunspots, similar to that, the laser is awesome at taking that away. Now, you might need a few treatments, but it's not very painful, and the downtime is really slim to none.
All right, great. Like you said, it's non-surgical, but these are
Yes.
in-house procedures that you can have done. Okay. How often should like a facial or something like that be considered to be done?
Facials can be done either monthly or every other month. Patients that get them really like them because it really gives a glow to the face. So those are things you can do a little bit more frequently. The laser is something you would do maybe twice a year, usually at most, and it really only takes 15 minutes. So it's a quick procedure. It's really a lunchtime procedure.
Interesting, a lunchtime procedure. I like that. Okay, so some people try like the DIY peels or at-home facials. Is that risky to do? Is it okay to do? What is your recommendation?
So there's a lot on the market and a lot that really markets directly to the consumer. And you have to be careful because some of those products have chemicals in them that can reverse what you're actually trying to fix. So for example, it can make your dark spots darker. It can make your rosacea worse. So you have to be careful. Some of them are helpful, but I would definitely talk with a dermatologist or a plastic surgeon before you use them, especially if you're already on some sort of oral medication. There can be some interactions with those. Over the counter can be helpful, but they're not going to be medical grade. So watch how much you're paying for it, because if the price is really high, it doesn't mean it's working. If it can get right to you without going through a physician.
Gotcha. And why not maybe pay comparable amounts of money to get the medical grade of whatever that is? Okay.
Exactly.
So in addition to like facial peels, what are some other non-surgical options that people should consider when they're trying to think to themselves, all right, I'd like to turn back the signs of aging a little bit?
Okay, so that's a great one. So lots of water, keep hydrated. Don't smoke. Or if you are, try to stop. Those are probably the two biggest things that affect the health and aging of our skin. And then there are treatments like peels. There are treatment that you had mentioned that are medical grade, and several different laser types. If you talk about the wrinkles, there are lasers that get deeper into the wrinkles and peels. So here's an example of a peel that was done with the laser machine, and you can see the before and the after. So really nice results. You're going to have a couple of days downtime with that. And then this one is what's called the halo. And this is actually an example of a male. So that shows you the benefit of both aging, wrinkles, and pigment. And that's probably about a week downtime. So besides that, there are daily treatments that you can do with skincare, with products such as the ZO product. Here's an example of that. And these are treatments that you can do daily that really get you ready for some of the deeper non-surgical treatments.
What you just held up, is that like a lotion? Is that like a blue light? What is that?
This is a cream.
Okay.
And it's a line that has several different kinds of creams depending on what you're trying to target. It could be acne, red, pigment, wrinkles, hydration. It's a vast line, so it does a really nice job of providing for all needs.
Okay. Let's talk about some maybe myths or misconceptions, because there are those in every single thing that we talk about, right? Not some myths and misconceptions about non-surgical treatments that maybe we should set straight.
Oh, I think some of the stuff that we get online about little gadgets can be very much of a myth. So the products that we have, the equipment that we have is quite expensive to be able to do what's needed and to be safe. If you're spending $300 or $400 on a device, I can't imagine it's doing a whole lot. Or it's something that you're going to have to literally do daily. So I think the biggest thing is just be really careful about getting sucked into schemes. And we're all prone to it because the advertising world does a really good job of convincing us. I think that's the biggest thing. The other is that you're not too young to start with. Not that I would jump to fillers and to Botox when you're young, but taking care of your skin you can do at a very young age because it's a lot easier to keep up with a healthy skin than try and turn back that time and get rid of wrinkles.
Let's talk about this, because everybody thinks, oh, I must be too old to use a anti-aging product. So let's talk about it. Is there ever a too soon or a too late?
No, the only time that there's a too soon or too late is maybe when you're talking about fillers and Botox for like teenagers. That's probably too soon. And if you're talking about surgery, there is a cutoff on age in the sense of heart and lung and thinking about the age. But when it comes to products, that you can put on your skin, like the ZO product that we were talking about. There's no too young or too old. And the reason I say that is because as we age, we're losing collagen and we're losing the ability to heal our skin. And these are the types of things that help with that. So typically, if you think of pretty skin, it's usually healthy skin. And that's really the goal.
Okay, so as we talk about ways to care for your skin, let's talk about maybe some gift ideas for like the skincare lover in our lives or ourselves, because we love some self-care for sure.
So I'm sorry, I didn't hear that
The
part.
gift ideas for
Oh,
those,
the
for
gifts.
ourselves or maybe for somebody else.
Yes, yes. So if you're thinking about a gift idea, some of the things that are that could be used for anybody are some of the dermal repair creams. And we have those with the ZO or the Sente product. A nice sunblock for Mother's Day is a great idea. We've got sunblock actually from Elta MD that has some tinting to it. So that's a really nice one for people who may want a little bit of color, but also want that sun protection. So those are some of the things that could be really nice. And you can always do gift cards too, to a spa or to our clinic, for example.
Gotcha. All right, let's talk about if someone has questions about like, how do I improve my skin health, or they want to learn more about the options that might be right for them. What should they do?
I lost you. I know you're talking to me, but I can't hear you.
That's okay. If someone has questions about what these products are or what they should do for their own skin health, should they start with you? Should they start with a dermatologist?
Okay, gotcha. So, yes, I would definitely say that most people should be seeing a dermatologist yearly to do skin checks. Even young people can get things, skin issues that may not be diagnosed until a dermatologist actually takes a look at you, and they do an amazing job. So I would definitely get in to see a practitioner, whether it be plastic surgery or dermatology on a yearly basis. And then you can also at that time, you can get some tips on some of the things that you might be able to do to improve the health of your skin. And sometimes what you see may be really small compared to a bigger issue. Like you may say, okay, I have rosacea, but you're not seeing the pigment all over the face. So I think going to see a practitioner is really important. And actually, we also have at Cone Health an esthetician, and she does an amazing job at really looking over the skin and giving suggestions on different products, facials, and things you can do to really turn it around. And she does an amazing job.
Okay, we have about a minute or so left. What are your final thoughts when it comes to skincare, our routines and things that we should know?
Start early and make it a routine. You know, you brush your teeth, take care of your skin in the same way, twice a day, if not more. And really hydrate, stay away from the things that dry us out. Tanning beds are really, really rough on your skin. And then come and see us, and we'll be happy to start a routine with you and really take that journey to healthy skin so that you can look healthy throughout your life.
All right, we thank you for your time and your expertise. If you missed any of this, maybe you want to send this to a friend or a family member, it's going to be in the To Your Wellbeing section of our website.